So we're on week 2 already, and it's going to go by really quick. You just had your first quiz. Next week will be quiz number 2, and your assignments for next week is just a discussion question 2. Now, went through and looked at discussions questions. I haven't scored them yet. They all came in, so good. That was very good to see those things that they were done. Now, next week to be interesting. I am not going to be here. I am actually going to be in Jamaica. My daughter is bringing me to Jamaica for a resort, and me, her husband, son, and my husband are going to go all down and just be pampered for a week. So you will have class with Professor Morris next week. So I'll be sending you the Zoom for that. It's only for 1 week. Now, there's some little things going on about next week. Next week is our exam reviews. I'm going to do mine this coming Saturday. It's pretty quick, it's soon, but I'm going to do it before I leave on vacation so that you do have your exam review done. I do look at the exams. I'm the one who makes the study guides. I am doing that week, reviewing it, making sure that all those key concepts that you need are at least mentioned on that study guide for you, okay? So that's with the exam. Week 4 is going to be your first exam. It does cover quite a few chapters, 26 through 35. I do have recordings in my YouTube channel already. You can go ahead if you want, look ahead, or you just wait for every week for me to do one. I talk about the same, add a couple little extras, subtract a little extras, or not. So there all of the recordings are there for you. So if you want to go ahead and do that, you're always welcome. You might see on my channel some shorts that my grandson threw in there over 4th of July. He stole my phone and was playing, and he's lip mouthing a song with his cute little hat on. And anyway, it's if you ever need something just to giggle for a moment, you can keep going on and make life fun. It'll make you chuckle. Anyway, so this week we're going to be going over our preschoolers, our toddlers, our infants, and we're going to be going more in depth with the theorists, okay? The theorists are the difficult ones. This quiz was all about Kohlberg and morality and knowing right and wrong and consequence for each. So as we go forward, you're going to see a lot of Erickson, you're going to see Piaget, which is all about thinking cognitive. So let's go ahead and start on our PowerPoint. Any questions yet? Okay, good. So chapters 31, 32, and 33. Let's start out with infants and what do we know about them? Well, we mentioned them last week, and one of the questions was all about, birth weight. So birth weights are important to know and understand because we can relate that first year or 2.5 years of life by how much they weigh. Are they getting enough nutrition? And we know that that first year is incredible. Where they're born, you cannot lift your head. Then by 3 months, you're lifting your head. Now you're going to be, starting to crawl, turn over, creep, and then eventually attempting or walking by age 1. So in the first year, that's a lot. Their weight at 6 months is doubled. So a 7-pound child is going to be weighing 14 pounds by the time they get to be 6 months. And by 1 year, they're going to be tripled. I believe it's 2.5 years where we get up to quadruple. So, that first year is that bulk of the weight that's occurred. Look at this where it tells you every month for the first 6 months, they have 1 inch of growth. That is a lot of growth. And now you can understand why nutrition is important because they're growing so quick. We need that nutrition to feed that growth to make sure it's a healthy growth. When they're born, as I said, their heart rate is 140 to 160. Respiratory rate is going to be 40 to 60. That first month of life, they say those are the numbers for that. As they get older, even in the first year, they'll go 140 to 160 heart rate down to maybe 100, 120 at 1 year. So the number decreases, heart rate, respiratory rate. Another thing that goes on is mom gives all that good blood and iron and all of that immune system to you at birth. Well, it's there till about 5 months, especially those red blood cells where the iron and stuff is. Now, those first 5 months were pretty okay with iron. Plus, we're breastfeeding, getting vitamin D supplements, and also iron fortified formula if they're on formula, right? So we're getting plenty of much iron. Well, then the cells start to die because cells don't live forever. Well, the body does not start making its own yet. So we get into what we call a physiologic anemia. It is not uncommon for a 6-month-old child to have a hemoglobin hematocrit of 10 and 30, 9 and 27. As long as they're not symptomatic, it's okay. So knowing that all the stuff comes from mom, and then that's where we need to really be watching these children to see are they getting sick because mom's immune system's going away? Or are they getting tired too quickly that their iron levels are low because their hemoglobin hematocrits are low? These are things that we'll watch out for because we know that's going to happen. Now we know the head at birth is bigger than the chest. Something you learned in OB, something that I learned actually just teaching the course. I didn't know it. I mean, I always knew their heads were big, but I didn't know in the relationship to the chest. And yes, the chest is smaller up till about 12, 15 months, and then they sort of equal out. And that's something to look at because what if the head's still big? Well, what's happening in that head? Or what's not happening to the chest, right? So is it hydrocephalus? Is there a brain tumor? What's going on? That head should be equal or less than by that age, at that 12 to 15 months. Another thing the head has when it's born on an infant is fontanelles. We have the anterior on the top of the head, soft spot, and then the posterior on the back of the head. Now, the one on the back of the head closes about 6 to 8 weeks. Closes pretty quick before you even realize it. The one on the top of the head usually closes by around 12 to 18 months, average of 14. Now, we're going to watch that fontanelle. That fontanelle tells you so much stuff. You can see a child, an infant who's dehydrated, can't we? If that fontanelle is sunken, something's wrong. Fluid balance isn't right. And conversely, if it's bulging and you feel it tense, this is probably a hydrocephalus. It's extra fluid in the head that shouldn't be there, okay? So the fontanelle is one of the first things on an infant who's been vomiting I'm going to look at because it tells a story. And then I'm going to look at things like heart rate and urine output and capillary refill, right? Now, babies are born and they look through each eye separately. They don't work together. Now, why do eyes work together? Well, it has to do with depth perception. They don't work together. You don't know which eye to follow to grab that toy or whatever they're looking for. By about 9 months, you're going to see them work together. That's called binocularity. Bi means two, and then binoculars, looking through them. Each eye is separate. As I said, they're born with mommy's immune system. We know all that stuff comes from mommy. Breast milk continues to give all of that maternal antibodies to that child. By about 9 months, is when our infants start making their own immunity. Remember, if they've been breastfed, they've got mom's whole immune system that they're working with. Plus, by 9 months, they've had 2, 4, 6 months of all of those immunizations. And it's 3, 4 each time, isn't it? We've looked at that big chart. Babies are born and they've got a lot of swollen tissue because they've been in fluid, right? So they're sort of edematous and puffy. Their eyes are all puffy when they come out. And the baby cannot heat this extra fluid that's carrying around in their extracellular fluid in their skins. So at birth, what do we do with infants? Well, we dry them off immediately. We put them underneath a warmer and they put a hat on their head. Have you ever noticed that? It's because their thermal regulation or the way that they keep their hot and cold, it doesn't work. And these children will get hypothermic unless that we do dry them off and get them underneath the warm as quick as we can. I mean, if you've ever had a child, they're born and they look puffy. They go to the nursery, a couple hours later, come back, and it even looks like their faces have changed shape, that all of that puffiness has gone away. And that is all that extracellular fluid. Now, we started to mention fine motor and gross motor skills last week, but let's go into it a little bit more. Well, think about questions, and I want you to remember to read them properly. If it's fine motor, remember F is fingers, has to do with the hands, okay? If it's gross motor, it's get up and go, go, go. G, that's movement. And that's how, looking at a question, you'll be able to answer those sort of things, okay? So prehension is when they start grasping objects, okay? First, we have that reflex palmar because it goes into the hand. So the rattle goes in and they grasp it. Or mommy's finger goes in and they grasp mommy's fingers. That is that reflex palmar. Well, then they start to be able to control their own grasp and they start grabbing their own, okay? They say by about 7 months, they can take a rattle from one hand and put it into the other. As they get further and fine motor becomes more refined, they start that pincer grasp. But remember, it starts out with sort of those Cheerios or those puff things on the high chair. They sort of smush it in at first. And then it gets to the point of a fine pincer grasp, okay? So crude is earlier than fine pincer grasps. By 11 months, they should be able to take things out of a container. And then by 1 year, they should be able to build a tower of rocks by 2 blocks. Now, does it mean there might be 4 blocks? Might be that they did it at 10 months, but as long as they're moving forward, this is just that guideline in those fine motor. And there we are. You could go and you could test yourself on what I just said. Now, gross motor. Gross motor has to do with movement. Get up and go, go, go. That's the Paw Patrol thing that my grandson taught me. So get up and go. What do we move first? And that's head control. Head control is about 3 months. They're able to lift their heads. Are some children infants earlier? Oh, yes. Some a little bit later? Oh, yes. But as long as they're getting it soon thereafter is what we're looking for. Now, babies about 5 months old can go from their bellies and they could turn over on their backs by themselves. This is something we need to tell our parents that now they're at risk for rolling off of everything, off of couches, off of changing tables, beds, and they really need to be secured. I've seen quite a few infants that came in that fell off of all of those things. So it's one of the things that for safety to teach. Now, by 6 months, right thereafter, they go back to belly. So it's actually easier, abdomen to back. 1 month later, back to abdomen. So now they're rolling over completely. By 8 months, they should be able to sit unsupported. And then by 10 months, going from their tummies, now they can sit by themselves. And that's a complicated movement for these children. Now, if you look at that top right picture, that head falling back, that is called a head lag. Now, that's normal up to 3 months, right? But after that, they should be coming their head up with the hands, like the picture on the bottom on the right. Now, if we had an infant that was 7 months old and their head's still lagging like that, there's a problem. Again, that would say we need to look why. Is it that they need physical occupational therapy, or is there something neurological going on? We need to do a medical workup, okay? That's why we need to know all of these developmental stages. We know locomotion movement starts with the head, which is your cephalic, and caudal is actually your feet, which is your movement, which is your walking and your running. So it goes head to toe. And if you look at everything I just told you about gross motor, you can see it starts with the head coming up, then rolling, crawling, creeping, and walking. Okay, so these are things that, again, crawling by 6 to 7 months, and they always go backwards first. I don't know why, but all of a sudden then they go forward. And that creeping means getting like on the side of the couch, standing up, holding on, and walking around. And then walking with assistance, 7 months, and then alone, or at least attempting by 1 year. Now, nutrition, nutrition, nutrition. I've told you it's the most important thing with infants. They are gaining triple their birth weights. They are, in length, that first 6 months, they've got 6 inches they've grown. So they're growing really quick by leaps and bounds. So they need good food. Now, before 6 months, we don't give any food because their GI tract is not mature enough. And if they ate food, it would just come out, in the stool, maybe diarrhea, maybe gas, and it wouldn't be absorbed, wouldn't be used, and it would just cause more problems. You would see actually the food in the stool if it was before 6 months. So the first 6 months, only human milk, breastfed, or iron fortified formula. Now you're going to see some situations where we put cereal in formula or even breast milk for children that have reflux. Now we do that for a different reason. Reflux, you're always spitting food out, so you're losing calories. So we put a little bit of rice cereal, actually it's 1 teaspoon per ounce, and we put it in there to thicken the food to hold it down so they don't vomit. So that's one of the ways that we would give food before 6 months, and that's the only way that we would do it. So at birth, we know there's going to be many questions from especially the breastfed mother. Are they eating enough? And 8 to 10 minutes on each breast should be enough. And then, of course, we're going to be looking at the diapers. Are they having 6 to 8 wet diapers a day? As long as this infant is having wet diapers, they're getting milk in because then the fluid comes out. That's the big test there. I mean, many of these parents have children that come in newborn ICU and they're there for a week or 2 or a month or whatever. And then they go home and they're so concerned because we measure everything so closely in the newborn ICU, right? And they're going to be like, well, how do I know? I don't have a scale. I can't look. And you're going to say, it's okay, mom. Just making sure every visit you go to the doctor, they should be gaining weight. And at home every day, you can be watching those diapers. Are they having 6 to 8 wet diapers per day? And that tells the story right there. Now, at birth, most infants lose up to 10% of their body weight. And that's because of all that extra fluid that they've absorbed, the amniotic fluid, right? And then they get rid of it and they lose all of it. And then they start gaining about a half an ounce a day for the first 2 months. They go from really tiny, skinny, and all of a sudden by 2 months, you're starting to look at that pudgy infant look. And as I said, breastfed babies should have some vitamin D supplementation. It's one thing they don't get in the breast milk. Now, as I said, at birth, the digestive system is very immature, and we do not start foods until 6 months because the GI system cannot handle it. And we can see, as I said, food in the stool. Even after we start feeding the infant foods at 9 months, you might see little pieces of fruits or vegetable in the stool, as long as it's a little bit, as long as it's not causing pain and cramping, and as long as they're gaining weight. Again, we're okay with giving that food to that infant, okay? And we know the liver is the most immature, and the liver is all about metabolism and medications, right? So as we're giving meds, we need to think that. So the second 6 months, the first thing that we're going to give is rice cereal. And the reason is they say it's the less allergenic of all of the foods out there. So we start with rice cereal. We'll put them on for 4 to 7 days, and we will look for some sort of allergies. Now, allergies could be a rash, could be that easy, or it could be vomiting diarrhea, or it could be anaphylaxis. You don't know. So as we're giving new foods to infants, we need to watch them closely. And we only start one at a time because we want to know what were they allergic to, right? So one at a time, 4 to 7 days in between. Now, many times we have a lot of food sensitivities, food allergies, or intolerances. There's quite a few foods that even myself, I just I just don't tolerate them for many reasons, whether it's heartburn or whether I get physical pain from some of them. Corn and me don't mix for some reason. And I'm the adult, and it does happen to children too. So again, making sure if they do have sensitivities, I know the physician will say, try it one more time, unless it was anaphylaxis, to see was it really that food or maybe it was something else. Again, looking to see what they can eat and what they can't. Atopy is that what we call those type of allergic histamine sort of responses, whether it's the eyes watering, right? Rhinitis, runny noses, asthma, of course, is a sensitivity or hyperactivity, and then that dermatitis, eczema. You'd be surprised how many young children have atopic dermatitis and eczema and need always lotions and creams on their skin because they're so sensitive. Once we figure out children do have allergies, what they will do is tell you not to put them, have those children eat that food. Some of them, they get an EpiPen if it gets to that point. Sometimes as they get older, they can go through desensitization. And that's when they're older, not when they're young. When they're older, they'll go through that so they can eat those foods. Now, babies sleep all the time, hopefully, right? And hopefully they sleep when you sleep, whether it's nights or days. I was a night nurse, so I wanted my children to sleep the day with me. Or when you're, that day nurse, you want them to sleep at night. So usually newborns will sleep 3 to 4 hours at a time. We know breastfed infants will wake up more often. If you look at breast milk versus formula, formula looks thicker, right? Looks like there's more substance to it. And breast milk is more fluid. Actually, they consider breast milk clear liquids, believe it or not. So they wake up sooner because they're hungry quicker, because the food goes away quicker. That's the one thing about breastfeeding. The downside, you can't eat as much. And we know infants sleep all the time. What's good about the napping, when they wake up, they're alert. This is when we put them on tummy time, right? Get their heads up, moving, searching for things, looking for those object permanence, right? You show a kid a little toy, you hide it, and then they're going to go start looking for it. And that's when their tummy times come in. I used walkers, I use swings, I use playpens. They say they're not necessary, and I think it's a parental choice, whatever you want to do, but they're saying they're not necessary. Dental health. Children, usually babies, at 6 months, they start having tooth erupt. Now, none of my kids had a tooth at 6 months. They were 15 months and then they got 8 of them at the same time. And that's not uncommon. But they say, and the book says, how old is your child minus 6 should be the number of teeth that they should have. So if they're 10 months old, it should be 10 minus 6 would be 4 teeth. Now, you can usually feel them underneath that they're coming up. One of the things with teeth and infants is, now, do we brush them? And the answer is yes. And it's just a soft toothbrush just to get the stuff off of them. Sometimes even just a washcloth with warm water and just rinse them off. And that's usually for bedtime, or nap time, so they don't have sugar on their teeth. My oldest son did have bottle mouth, which was all those rotten teeth. He used to carry his bottle by the nipple with apple juice in it, like this, and run around all day long with it. And his teeth did turn black. I mean, today he's got beautiful teeth, but as an infant, I failed as a mother. I didn't know any better. So I'm reporting myself to y'all. At night, you shouldn't prop any bottles in bed, and no milk and no fruit juice. Again, that's the sugar on the teeth and it can rot them. And I've already talked to you about pacifiers, that they are something that soothes a child, the infant. It's also because they explore the world in their mouths. So whereas I've heard back and forth and all over the place, is it good or not? The answer is better than it is bad. Yes, may I help you, Arona?
So when you said no fruit juices, did you mean like no fruit juices in bed or no fruit juices in
In
general?
bed. In bed. And juices shouldn't be started until 5 to 6 months. And fruit juice should be given after they eat food, just like milk. So that doesn't take up the space in their tummy that they should be eating food with. Okay. Okay. Fluoride, most water has fluoride in there today. So we're actually pretty good with that. So putting more, not necessary. Now, did you see those big pages of all of those immunizations? Those immunizations in the book is quite like, oh my goodness, what do I need to know? Well, we know Hep B is given at birth. We know that tetanus is after you step on something, and we're going to go into that later on. MMR is 15 months. Varicella is a live vaccine. That's something that you should know. You don't give any immunosuppressed infant or child or adult anything immunosuppressed, a live virus, okay? Influenza is not given till 6 months. So that's when we start that. And we'll go into some of the others, but those are some key ones that you'll see. Now, I think one of the hardest things to take care of is a child who has colic, right? A child is always full of gas, always crying, and it's usually the first couple months of life. And these parents are exhausted. I mean, many of them, and I've seen it, some even my friends, put them in the car seat, and ride around the block because that's the only way that they'll get any comfort. So again, what can we do for these parents? Well, number one, making sure that it's not due to overfeeding, underfeeding, not burping correctly, sitting them up. There's all sorts of medications that can be used very safely on infants, but usually they just grow out of it. We know some kids sleep a lot and some kids don't, and that's, those different sleep problems. Now, failure to thrive is a real thing, and it can be perfect parents feeding the child the way they should, going to the physician, getting their formulas changed or breast milk, whatever, making sure that they're getting all what they could, but they're just not growing the way that they should. And this is serious because they're not growing the way they should with the nutrition they're receiving. Their body's not getting the fuel that they need in order to be cognitively aware, to be growing for their muscles, central nervous system, to be able to mature. So they do look at it very closely. They look at any metabolic problems. They'll be looking at the GI system, etc., trying to make sure that we give this child what they need to get the calories they need to get the nutrition, nutrition, nutrition. Now, children can today, because of SIDS death, SIDS death says that we put our children on their backs or lay supine when they're taking naps or for their bedtime. They have found through extensive research that laying on the side or laying on their tummies increases the incidence of these unexplained first year of life deaths. But what it can do is it can cause the back of their head to be flat. I've also seen it in the pediatric and the newborn ICU where they're on these machines where their heads are to the side. They're only laying on one side because they have big IVs coming out of their neck, supporting their respiratory or cardiac system. And they get these flat heads or toaster heads, as we call it. So, what do we do for this? Well, if it's just a normal kid back to sleep, their back of their head is flat, we would use that tummy time, get them off of their tummies. And when we get them off their tummies, they would be able to start to unflatten that. So here I have one of the students said that their child had to wear those helmets. When you see these children, I usually see them in the grocery store, and I'm going, oh, another football player. But what it does, it helps that reshaping it. It doesn't bother them. And yeah, it is usually due post NICU, long terms, and then making sure that their heads round up really, really well. I think diaper rash is one of the biggest common problems in infants. Now, it could be due to many things. It could be due to soap, lotion, and it could be due to the type of diapers. My children could not wear Huggies. They would have a big rash. But I'd go to the local grocery store and get the cheapest diaper brand, and my children were not allergic to it. So go figure at that point, right? Also, it could be due to foods that they're eating. And that would be one place you would look those when you're starting to feed food to your child. It could be causing it. The thing about diaper rash, it will keep you awake at night because once they urinate or stool during the night, they will cry because it does burn. So opening it to air, putting a good ointment on there to keep it protected, and figure out why. Why is that child with a diaper rash? Was it food, lotion, diapers? What is it? And to change that. I mean, they've got all sorts of sensitive everything out there today, and even water wipes you can buy, which have nothing in there also. So getting that cleared up as soon as possible is, will lead to a better night's sleep for everybody. Now, cradle cap can be concerning, especially if you have this beautiful little girl and you want to put these beautiful ribbons and bows in their hair and their head's all full of these scabs, right? And you want to get rid of it as soon as possible. Well, how do you think we would? Well, there's a couple different ways to think of it. I have seen one book say put olive oil on it or a nice oil at night, and then in the morning, give them a bath, and just with a fine comb, just gently brush out all of the flakes. It's not going to happen overnight, but after all that moisture and keeping it moisturized, that's how we get rid of that cradle cap. And I think it's just physically parents just, I want to get rid of that because I want my little girl to have those little cute little bows that I bought her. Alaya, yes, something from you?
So even with the olive oil, and like moisturizing, doesn't it still cause baldness? Baldness?
Not necessarily. Not necessarily at all. No. All it
Okay.
is, the skin underneath, it's dry. And you have to just make sure you moisturize it and just slowly get it off. I've never ever heard it cause balding.
Okay. Because I maybe I did it wrong, but my son was bald. He had a head full of hair, and then I tried to like gently, like I moisturized with coconut oil though instead of olive oil.
Okay, that's fine. Same thing. It's good stuff. Smells good too.
But yeah, he ended up having no hair.
How old is he now?
He's two. I mean, he has hair now, but he went from having a head full of hair at birth to having little to
That's,
none.
and that's not uncommon either. They
Okay.
lose it all and they grow it back, or they have nothing at birth and then by 1 year their hair down to their butts, like my daughter. So they're all different, and as long as the hair's growing now, I don't think it had anything to do with that. Okay,
Okay.
but thank you for the question. So we mentioned a little bit about SIDS, right? SIDS death is sudden infant death under the age of 1. And these are those things that they think are the risks. They think it's, of course, your ethnicity, absolutely, but males more than females. We know it's nighttime, and it's right at that 2 to 4 month time where they do it. So, what are the things that causes those SIDS deaths? Well, sleeping on their tummies, cigarette smoke in the house. So anybody who wants to smoke, go outside. Having them too hot, and that's not uncommon. Most people think that because the air conditioner's on, they need an extra onesie or put a blanket on them, and there should be no blankets in the cribs either. Okay. What if they just had a little upper respiratory infection, little airway, nasal mucus? That causes it also. Think about an infant. What do? They suck, they swallow, and they breathe in their mouth. They don't do much more with it. So, put a little mucus in the nose, and they're obligatory nose breathers. That's when they stop breathing too and causes its death. As I said, breastfeeding helps it not have SIDS death. So lack of it can cause an increase of SIDS death. Poor socioeconomic, which could be no air conditioner, could be homeless, could be mom's not eating right, baby's not getting the right food, whatever. All of those things can cause it. No or late immunizations. We know immunizations are there to prevent these really bad diseases. So if they get one of these things like rubella or pertussis, it could be life threatening. We know quality of air, we need good air, and using a proper mattress, a hard mattress. And they say no cohabitation at night. I've actually had 2 different cases where one of them, daddy was a larger man and the baby wasn't sleeping. So he put the baby in bed with him, and actually his wife was there too. And apparently at night he rolled over on the infant and smothered the child, and the baby died. So cohabiting is not a good thing also. Now, one thing that in infants we see is what we call an ALT, or an apparent life-threatening event. It could look like a choking incident where the baby chokes and doesn't take a breath and gets purple. This is what we consider that acute parent life-threatening event, an ALT. And these children will be admitted. We'll look at the GI tract, seeing if it's reflux. We're going to be checking the neurological status, making sure it's not seizures, and they will be sent home on one of these home apnea monitors. Now, these home apnea monitors are really easy to use. They've got 2 leads, that are stuck on this Velcro strap. And you just put it across the nipple line, and then you set the monitor. Now, this monitor alarm is earpiece piercing. I mean, it hurts. I mean, usually it will wake up the infant and hopefully will wake up the mother, startles them, and they start breathing. So one of the big things in injury, we know any age child is motor vehicle, right? Making sure that an infant at birth, they're rear facing, they're staying in the middle of the back seat, not on the side. That's the safest place. Um, New mothers getting taught CPR is really important. And then, of course, some teaching on safety at home as the kid gets older and explores more. So, Letitia is a breastfed infant being seen at the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention?
That she would breastfeed the child more than often.
Thumb sucking is normal. Thumb sucking is absolutely normal. They'll finger suck, they'll thumb suck. We know that how does an infant soothe themselves? It is through their mouth, right? Whether it's through a pacifier, a thumb, or a finger. So it is normal. Actually, this infant has learned how to soothe themselves. So let's look at some theorists, okay? And these theorists are from Erickson, Piaget, Freud, and Goldberg. So Erickson, infants. What do infants know about their environment? Psychosocial. This is all about their environment. Well, they know if I cry, they know somebody's going to get them and burp them, feed them, change them, hold them what they want, right? That's usually what will happen. And that is called trust. This is when a child is happy and it's just, very good temperament. Then you have an infant where, for whatever reason, that infant is not picked up the way that they should be, which means it is delayed. It is where these children, maybe it's parents that they're homeless, maybe it's, drug abuse, alcohol abuse, physical abuse, any of those things where they just don't pick up that infant. And after a while, an infant will stop crying because nobody's coming anyway. So we will see that child, that infant will act differently than a happy child. That's all the needs met. So all the needs met, it's trust. And the opposite side, where their needs are not met, that is mistrust, okay? Now, cognitive development. Now, this is Piaget. Remember I told you that you get a rattle, and by by reflex, they grab the rattle. And then all of a sudden they move it and it makes a noise. And they go, ooh, I like that. And then we put it in the mouth and we go, ooh, I like that too. And then every time they get the rattle, that's what they're going to do. Or they're going to take their finger, thumb, and that's going to go in their mouth. And that is, again, they're always self-soothed and they're pleased with exploring through their mouths, okay? We know that it starts with something simple like a grasp, and then it builds up to the point where that you grasp that rattle reflex. Now you do it voluntarily. Now you're going to put it in the mouth, and now you're rattling it because you've learned from the step of just grabbing it. And that's what that schema is and what that means. Now, Piaget has several types of development. Sensory or motor is all aspects of play. That's another quiz question. That's always an aspect of play. It's about the sense, the touch, the feel. Ori is oral in the mouth, which we know they self-soothe and explore the world in their mouths, and then motor, moving it. Pre-operational is where we start playing, like taking a broom and now it's a horsey, riding it around the room, or putting the arms out and now you're an airplane. Now this is the magical that goes on. Now, concrete is school age. And again, what is concrete? It's solid. I can see it, touch it, feel it. That means I understand because I saw it before. I seen it happen. I listened to it happen. I watched it happen. And now I can repeat whatever it was. And then formal is what I call your adolescents fighting their way out of a paper bag to go out on Friday night with their friends where mom already said, no, you can't. They know how to manipulate and how to figure out thinking what they need to do to get out on Friday night with their friends, which is what they want to do. And that's adolescence. And those are your 4 stages. Now, children all of a sudden start to realize that they have a body and they start looking at it and they're realizing that they see yourselves in the mirror, they touch it. Again, we know that the mouth is always their pleasure because this is where they explore the world. And then remember that object permanence. This is by the end of the first year. They know if you put something next to them or on tummy time, they're going to start trying to hunt and search for it and get it. Just because it's out of sight doesn't mean it's not there. And that's what that means. And they know mommy and daddy. Social development, they know that usually the infant likes mom, dad, grandma, grandpa, and doesn't really want anybody else usually. Separation anxiety is when children need to go to a stranger or go to daycare and you have to hand them over. And that separation anxiety, if it's even going into the hospital, there's 3 stages of it. And you're going to do a discussion question on it. But just briefly, what it is when you have to give a child over, let's say, to a nurse, and you have to go home for a quick reason and you're being admitted to a hospital. So the baby is put into a crib and the baby sits there and cries because they just want mommy to come back. That is the first stage of separation anxiety. The second stage is where they're like, all right, I've cried enough. Nobody's coming. The nurse is here. All right. Well, now we're going to regress. They might start sucking their thumb where they haven't done it in a long time. They might start being incontinent where they've been potty trained. The older children, of course, it's part of it. And then the third stage, mom finally gets back and the child doesn't pay them any attention. It's like the mother's like, well, why did I come? The kid don't want me here. And it's just part of this normal separation anxiety. Stranger fear, if you have children, they don't want to go to anybody unless it's somebody they know. But they do that peekaboo, don't they? They'll look around the corner at you, like around mommy or daddy's shoulder. And that's about 9 months where they start to do that. We know play is all about social development, playing with each other as we go. So toddlers. I think the best thing that's here is all about having a toddler is like having a blender without a lid. What does that mean? What that means is these children are into everything, okay? Absolutely everything. They're exploring. Remember, they don't know anything. They want to know. They're like thirsty sponges. They're soaking up all of this information, all of these things that they're looking at. And that's why they're terribly too, because you can't keep them out of everything, okay? And this is the stage of autonomy, which is all about me, mine, no, 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 no. That is a toddler. Now, when they hit 1 year old, 1 to 3 is a toddler. their weight slows down a lot. Because look, by 2.5 is when their birth weight doubles, triples, quadruples at this point. So it had tripled by 1 year, and it took till 2.5 for it to quadruple. So it took quite a while for that to happen. Their height, 3 inches a year, not 6 inches a year like infants, right? Their legs are getting longer, not their trunks. They are start growing, they get pudgy and they grow, and it's a stair step thing. Their head, as I said, should be equal to their chest. And actually, by age 2, a child should be about half their adult height. As they're getting older, all of their body systems are getting better. We know that they're by toddlers. Usually they've been around other children, if not in daycare, because most people have to have their kids somewhere because you have to work, or with another group of kids or another family to watch them to help you. And we know at that point, children, when they get together to play, especially toddlers, sharing toys, they're swapping spit all day long. And that what they do is they're sharing all their germs. Now, it's a good and bad thing. You need them to get the germs so that they build up these immune systems. So by the time they get to school, they're not going to be out as much, okay? But still, a kid with a chronic upper respiratory, ear infections, tonsillitis, these are all the big common ones that are there. I mean, if you think about toddlers, they have these short, open, wide eustachian tubes. They're very short. Mucus goes from the back of their throat up into their ears, and there we are, ear infection, okay? We know children can maintain their own temperature. They don't have to be overdressed anymore. It's not like that brand new infant. We know by the ages of 1 to 3, we're going to start potty training, and bowel training is before bladder, okay? And our skin is intact. So gross and fine motors. Well, coordination. Just look at the way that children walk and run by up to age 1, and then the age of 2 to 3. They're just much more mature, and they're not as clumsy as they were. They can throw a ball overhand, 12 to 15 months. Oof, and they do it well. Their visual acuity. Remember, we went from both eyes seeing separately to seeing together. Now we're about 20 to 20 over 40. So vision is almost perfect, and depth perception is so much better, and they can grab things easier, move a lot easier. Another thing that happens in toddlers is that they become picky eaters because their senses of taste and smell have increased. Have you ever tasted baby food or formula or cereal before? It is very bland and not that pleasing. So toddlers now are understanding there's other foods that taste better, and they don't want those foods that don't taste good anymore. And they don't sometimes want something because of the way it looks or the way it feels. Because a lot of these children, ages 1 to 3, are still using their hands, that pincer grasping foods, right? And as I said, exploring everything, and they use all their senses to do it. Now, Erickson. So, infant Erickson was all about trust and mistrust. Erickson and toddlers, ages 1 to 3, is all about autonomy versus shame and doubt. What does that mean? Well, autonomy, automatically me, mine. That means being self-centered. It's all about me, mine, and they're not going to share. And no, 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 no. Absolutely common. Toddlers love to be in routine or ritualization, which means schedule. They like a schedule because they know what's coming next. Why do you think it's so hard to take a toddler on vacation? Because they're not going to get the nap at the right time. They're not going to eat the foods normally. They're not going to bed the same time. And all of these things mess with them, and they're not comfortable. and they don't know what's coming next. So that ritual is how you can straighten that out. And in a hospital, we can find out what those schedules are and try to keep them where they are. And we know id is where we start out, which means not worrying about anybody but me, mine, mine. And then as they get older, now they'll start that ego, super ego, which is understanding other people and then realizing rights and wrong as they get older. But they're in that id stage, all about me. Now there's different stages of cognitive development, Piaget, and there's all different things that tell you about it. So there's 6 stages of it. Now, I just want you to know that it starts with sensory or motor, and that's all about moving things, et cetera, et cetera. And again, it starts out with grabbing the item first, realizing, does it roll? Does it make noise? Does it stack? What can I do with it? That again is another process. And that's all about what this means. That pre-operational, that's more of, again, riding the broom's handle, and you're a horse at this point. Now, Piaget, Erickson, and Toddlers. Erickson is all about autonomy, automatically me, mine, mine, mine. It's all about saying no, 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 liking to be in schedules. And then it's all about self-centered, the autonomous me id. Now, Piaget is all about thinking and understanding and then applying what you learned to a next step. They don't know what the next step is, but they're going to be learning that. And that's that tertiary circular reactions. They start experimenting. Can these rocks stack on each other? Oh, no, they can't. They're rounded. Oh, but these blocks can stop on each other. So it's learning, it's experimenting, trying to figure out what works. It's all, I mean, they're magically thinking, they're, experimenting, and they're learning by all of these, trying and failing and trying and succeeding. So sensory motor, another thing that I can tell you about is, I've already talked about things in the mouth. I've already talked about the rattle and rattling. Another thing these toddlers can do is, usually mommy will put a sippy cup on the high chair with them, right? When they eat. Now, mommy goes into the kitchen or somewhere to do something, and that child wants mommy back. What is that child going to do? He is going to grab that sippy cup and throw it on the ground because he knows it went on the ground. Mommy's going to hear it. Mommy's going to come. That's tertiary circular reactions. Because I did this, I know mommy's coming, and that's what I wanted. So again, it's thinking, figuring things out, getting what they want. So when they're the end of these toddlers into the beginning of preschoolers even, is they're starting to understand that they have something between their legs. They're going to be touching it, feeling it, knowing there's something different. They know there's boys and girls. They know there's mommies and daddies, or whatever, the relationship is in your home. They start with this understanding about it. We know that children in social development, they know that a lot of it, social development, is what mom and other people have taught them. And it's also about if they have to be separated, they understand mommy's coming back, daddy's coming back, Nana or whoever. Another thing about development is that children like transitional objects, things that give them comfort. Is it a pillow? Is it a blanket? Is it a doll? Is it a specific pacifier? Their language keeps getting more and more. Now, an infant by age 1 should use one word: Nana, Pop, Mommy, whoever it is. Usually those are the things, or milk or more, those sort of things. Their behavior as a toddler, they're becoming more and more independent. They're going to want to try to dress themselves. They're going to try to do those things for themselves. They don't want anybody to touch them, bother them with them. And I like this strong-willed behaviors. Mine, me, I do. And they're starting to realize feelings for others. And the one thing I remember about my little Christian, he was 2. And I remember being on the couch and I was having an RA flare where my knee was really bad and it was packed in ice. And this little kid, 2 years old, came over and kissed my knee and told me all better. And that's when I realized that little toddlers too have feelings for other. I always thought there were more about themselves, that autonomy, right? Now, play. Toddlers, the one thing you need to know about toddlers is they love parallel play. Again, next to each other, using their own toys, not sharing, but they can play in their own places next to each other. Okay? There's no sharing, there's no playing with each other's toys. It's playing next to each other. And they do that imitation and tactile and whatever. Now, potty training, there are signs when they're ready to potty train. I think one of them has to do with telling you they can feel, something, or they want to go to the potty. I mean, that can happen. Also, if they are there and they can hold their bladder in their diapers for 2 hours, usually they say that's one of those signs that they're getting ready. And as I said, bowel happens before bladder. There'll always be sibling rivalry. I had 6 brothers in the house, so we were always fighting for something. I want, he wants, she wants. It was always something going on in the house. Temper tantrums. Anytime it can happen. They say temper tantrums you should ignore unless what they're going to do or what they're doing can harm themselves or others. So if they're having a temper tantrum, and that usually in the grocery store was the big one for me and my kids, right? All of a sudden they are going bonkers because they saw a box of cereal with whatever character on it. And I say, no, you can't have that. And they go bonkers. So again, temper tantrum, let them have their moment, just making sure they're not going to hurt themselves. As I said, no, me do, mine, that's the autonomy part of them. And as they are in stressful situations or in a hospital or mommy has to leave for a little bit, they do that regression. They'll go back to maybe wanting a bottle where they haven't used one, or sucking their finger, or wanting a pacifier, or being incontinent when they're potty trained. All of these things show you stress. Now, toddlers, as I said, their taste and their smell really do get refined. They can really taste better and smell things better. And it causes them not to eat as much. But as I said, from 1 year to 2.5 years, you only gain one part of the body weight from birth. So you've tripled it by 1 year, and then it's quadrupled a year and a half later. So do they need as much food? No. Are they growing as quick as the first year? No. So they don't need that food. A lot of times parents get really concerned because they're not eating and they think they haven't had enough. As long as cognitively they're aware, alert, moving forward, and as they're gaining that little bit of weight they need, that showing nutrition is enough. Remember, as we start getting older, that foods with the vitamins and whatnot that come in it are not going to be there. For instance, whole milk. Whole milk doesn't have calcium and vitamin D in it the way that they need it. Yeah, it has some, but they might need some supplements with it. So it's something we need to look at. And then, of course, do they get enough protein? Remember, if they are vegetarian, and I know most parents don't start them vegetarian rate when they're little, but if some religions, they might. So making sure they have enough protein, because we know that has to do with wound healing. Always remember, protein equals good wound healing. We know that there's also complementary alternative medicines. Many cultures believe in different things, and making sure we need to know what they are and can they negatively or positively affect the care. The one thing that I always think of is, my husband is Jamaican and he loves ginger garlic tea when he doesn't feel well. And GG, both, if we look at supplements, they can prolong bleeding times. So if there was already something with bleeding, we wouldn't want to make that bleeding prolonged or more. So it's something we need to think about. It's now we're doing, finding out what supplements are you on, what other things, vitamins do you take. We have found out they do make a difference in medical care today. Toddlers is hard to put to sleep at night, but if we put them in a good routine, and read a book and turn the light out, ready for bed, maybe a night light in their room, usually that will help. That's the hardest time, I think, for toddlers. Dental health, they should be getting some exams by a dentist. They should be brushing their teeth and fluoride in the toothpaste if it's not already in the water supply. Children love many different things. Lead, and it's actually a real thing, and mercury. Now, mercury is something we don't really see much of. It's usually from those old thermometers, the ones that you shook down. It's the mercury in there that they're concerned about. We don't really see that as much. Lead poisoning. This is where we have older buildings and children love to stand up on windowsills and chew on, the bottom parts, the wood there sticking out, the windowsills, and they chew on them because of their teeth and teething, and it could have lead paint. Again, lead is dangerous and it needs to be treated, whether medication or through an apheresis. It's almost like a dialysis sort of thing. We know kids love to eat things, put things in the mouth. One of the things that we need to tell parents is to always have the poison control number there in case it happens. Let them know. We do not give Epicac and induce vomiting on anything. That's one thing changing from the past because it could burn on the way up and it could cause more problems. Safety promotion, injury prevention. Again, motor vehicle is always going to be number one on safety. Drowning, living in South Florida, do the kids know how to swim? Or are those pools, with the ladders not in the pool, or they have a fence around them, making sure that this is something parents know. Children will go explore. Oh, I want to go swimming and go, and you find them at the bottom. Children, especially toddlers, are so awkward and uncoordinated. They're falling and they're hurting, scratching their knees and elbows, et cetera, et cetera. Aspiration. This is like those baggies. They like to try to blow balloons up with it and actually suffocate. So again, safety, injury protection is so important. I actually, believe it or not, remember that metal car seat. And I did sit in the front seat as a young kid. And actually, my brother sat next to me, who was 2 years younger. So I'm actually showing my age off. Sorry, but they did try, but we did sit in the front seat. But if you know what those cars, they were like tanks. I don't know if the car seat could have hurt them, just being flying out of them because they weren't secured well. But we know car seats are important. We know they're in the back seat till 2, and then we could turn them around. And they want you in the car seats, booster seats up to age 8, and they don't want you even as adolescents sitting in the front seat. They still want you in the back. Again, gross motors, we've been over that. And now preschoolers. Preschoolers, ages 3 to 5. Ages 3 to 5, and these children are now coming from the house or maybe a daycare and then going into preschool and to kindergarten. So now other people are starting to influence your children, other cultures, and they have to learn how to go, sit, take instructions, and to have attention. And we know attention span for some children is really, really hard. One of the things parents can do is, as we're getting them ready to go to school, as telling them how great school is and that positive attitude. So we should actually be reading to them every night before they go to bed. I know one thing about my grandson. He loves to read, he loves books, and he now reads books to his mother. So it does help, with his education. Again, preschooler, everything's slow. All right, 5 pounds a year, maybe they gain 2.5, 3 inches height. So it's really slow. Body systems are getting more and more mature, and preschoolers don't need as much of that routine as toddlers. Gross motor on these preschoolers: walk, run, climb, and jump. Fine motor, fingers. Now we are dressing, drawing, making circles, buttoning up shirts. I think it's by 5 they should be able to tie their shoelaces. But everything is Velcro straps today. So how many young kids learn how to tie their shoes at a young age? Think about it. Do you know any kids that have tie shoes anymore? I don't. Haven't seen them. All right, Erickson. Developing a sense of initiative. So this is multi-focused here, okay? They want to learn, they want to help you do things, okay? And it goes through also a trial of error with right and wrong, understanding doing things the right way. And this is they get because when they do things different than they know that they should, then they're going to feel bad, which is part of that moral thing. And that super ego, something is telling them, oh, you shouldn't do that. It's not right. Cognitive development, as I said, alert. They're getting more open and ready to go to school. Again, having that positive attitude, reading for those children's help. Cognitive Piaget. This is all about now starting to think about they know when they do things what the outcome will be, whether good or bad. They don't understand time. They don't aware of that yet. So what do they understand? Well, your mommy's going to come after lunch today and she's going to pick you up. Or when the sun comes up in the morning, we're going to Disney. I mean, they know certain events related to time. They don't know at 5 o'clock, mommy's coming for you. They don't understand that, okay? And they're absolutely into the point of thinking magically. Ever watch a kid play with toys and having men flying in the air and going to the fire truck and, talking, and this other truck comes up and they're just sitting there talking and making up their own little stories as they play. I mean, that's why play is important, because they're, making that magical. Again, Kohlberg, right, wrong, good, bad, and that consequence, and one way that we can describe it is punishment versus reward. I'm going to be punished when I'm bad. I'm going to reward you when you do something good. No, get out. Wants me to buy him a game. Can you imagine that? Development of body image. So children, when they get cut, they have what we call blood come out sometimes, right? When it's blood, they think all their insides are coming out. They feel that if they don't put a Band-Aid on it, it's going to keep going and going and going, right? And one of the things about that is to have a lot of Band-Aids on hand, right? I can't even tell you how many types of Band-Aids are at my house. And again, another thing with body image, they're starting to understand different colors of people, different, heavy, skinny, tall, short, all of those things. They're starting to be aware of all of these differences. And another thing they get afraid with is stuff that goes into them. Even like blood pressure, squeezing them, it's intrusive, is that word. Especially just, and the other one, of course, is needles, IVs, blood work, etc. They don't like it, they're afraid of it, and again, it's how you teach them. Now, Fowler is spiritual, okay? And spiritual development is what you get from your family. Whatever your family is spiritually around, that's what you know. You might, if you're something different in school or church or after school, might learn about another religion, but we know that spirituality is something that comes from home. Another thing with spirituality is children on the whole believe that whatever the name of that higher power is if they do something wrong, it's going to punish them. So I broke my arm because yesterday I kicked my brother. This is where their mind goes to. So again, it's that misinterpreting illness as punishment. So that is real. And also bleeding out, needing band-aids. This is real. It's the way that they think. Now sexuality, they know boys and girls. Well, they've gone through potty training. So they've gone through knowing about that, do they have a penis? Do they have a vagina? And then, of course, they go into the bathroom with daddy and mommy, and they're seeing all these differences. So now they know the differences between both of them. We know girls like daddies and boys like mommies. It's just what it is. We also know that they're going to be exploring. Not uncommon, for instance, to find two children the same age looking at each other, seeing the differences. And then you're going to say, so what should you do if you see something like that? Well, exploring is not a bad thing, and it shouldn't be looked at as nasty or dirty. You just need to say, okay, come on, let's go to the other room. Let's do something else. You don't need to be doing that. You do that by yourself, right? So you've stopped the situation. You haven't told them it's bad because they need to know their bodies, but they don't need to be doing it with their cousin or their next door neighbor in in another room when you're not aware what's going on. Another thing is answering questions for these children. If they ask a question, ask them what they know first, because sometimes they don't need to know about, sexual intercourse is not what they're asking for. They're just trying to figure out, how did this work? Well, mommy has an egg and daddy has a sperm, and then they made a baby. You don't have to go through the whole process. And that's the younger kids here. Their social development, we know that they're over that stranger danger and separation of parents. They know mom and dad's coming back for them if they're brought up somewhere. They also know that if a kid has to go, let's say, to auntie's house overnight because of whatever, if they bring their blanket or their pillow or their toy, they're going to be okay because that is their familiar object with them. And that goes with the hospital too. Bringing that familiar thing makes them feel less threatened. And if a kid have to be in a hospital, is having a lot of fears, play therapy is great. And just called play therapy, where they're going to go give a doll, ask little things about where they were, what bothered them, give them pieces of equipment to play with, and they can pick out and sort of show you where and how they got scared. Their language is getting more and more sophisticated. They always have a word that they use a lot of the times. Transportation or teleportation was a big thing on Christian. Everything was teleported somewhere. They're going to come up with a word and misuse it and not use it in the right sense, but they're trying really hard to have these sophisticated languages. And now they're able to get their points across easier. When they're toddler, sometimes you don't know what they're trying to tell you, but by preschooler, you're starting to understand. As I said, that ritualism is not as much as you need as when you're a toddler. Your preschooler should dress themselves. I told you they love to please, they like to do things for you, they love to help you. Their values come from the family, it's what they know well. And we know that now preschoolers are going to question you, well, why do I have to go to bed now? I'm older than my sister. She's going now. I want to stay up longer. And this is that, checking that, challenging the family's code. Play. Well, toddlers are parallel play, right? Play for a preschooler is many of the times associative, which means what? Two or more children playing together, and there's no goal. They're just playing together, having a good old time. And as we get the older part of preschooler into school age, it's cooperative play. And that is 2 to 3 children playing together. And there's a goal. Is it a board game and somebody wins? Or are they at the beach building, a sandcastle on the sandcastle? Or are they building a road track? Are they building a house? When they do something, there's a goal in the end. That is cooperative play. Imitative play, imaginative play, all of these things are stuff that they do by themselves. Dramatic play is, part of that play can show you, what they're afraid of, like play therapy in a hospital. And of course, mutual play is playing together. Some of the biggest fears in preschoolers are dark. They don't like dark, they don't like being alone, and they're scared. They don't like big dogs. They've got this deep voice and bark, and they're afraid of them. And I don't know how they figure out that there's ghosts around, but there's ghosts everywhere. So we tell little Christian, when you see a ghost, let us know so we can go and say hello and find out what their name is to see if they need anything. So we make it more of less threatening, but it's one of the big things. They're afraid of castration. Their body parts are going to be cut off or, even cut and blood oozing everywhere. It's part of it. And look at this. They're afraid of objects or people associated with pain. Who do you think you are as a, up and coming nurse? You're the one who gives an injection every single time you see them usually, right? So we are that person that they're afraid of. So sex education, as I said, let them tell you what they know first. They do suggest to use correct anatomic words. My grandson knows penis and vagina. That's what his mother said she was going along with, so I'm okay with you. So that's what it is. They're also now touching themselves, usually in their rooms. I know sometimes I've seen, hands down the pants. I'm like, take your hands out or go in your room. I don't need to see you doing that. That's something you do privately. So it is part of preschoolers. And I've already talked about their fears. Speech problems in preschoolers, we know they should be speaking pretty good by now and fairly clearly. And if they're not, this is when early intervention and this is when early speech therapy should be instituted. What's the best thing about kids is once you give them the tools they need to get better, to improve, they do really well and they actually catch up really quickly, as long as the parent keeps them going into the therapy. Children that are preschoolers have nightmares. My second oldest grandson had horrible nightmares, and he'd be screaming at night and he'd be asleep and not remembering them at all. It was all part of it. In fact, actually ended up in the end giving him some melatonin to help him relax at night to go to bed. So it is a real thing with this age. Again, bedtime rituals, not up and jumping, running around and say, okay, bedtime. No, it's quiet time, relax, watch a movie, read a book, sit down, hugs, whatever it is. It should be that slow down right before bedtime. Injury prevention, always you're going to talk about. Motor vehicles will always be there. And then as they get into sports and using things, making sure they have helmets and elbow protectors, wrist protectors, knee protectors, that they have what they need, because kids do get injured really easily. They don't know that things will hurt until they've gotten hurt, okay? When we have kids and they're just entering into school, remember this is the first time that they are away from parents, many of the time. And they've got to be in this controlled situation. And now they're learning all about other people, all about other children and cultures, et cetera, et cetera. And they're going to start getting their best friends, right? They're always going to be talking about a certain girl or guy that's their friend at school. And they're always going to be telling you about, what did you do with them today? Communicable diseases, this is all part of kids, right? They're always getting sick and runny noses, et cetera, et cetera. So one of the things that we need to recommend always is keeping immunizations up to date, making sure children know how to cover their mouths, wash their hands. One of the, I think, hardest of the diseases to keep control of, even though there is an immunization, is chickenpox, varicella, because we have a period before this child breaks out with a rash. That's when they are contagious, 4 to 7 days before that rash comes out. And they are contagious up to the point where all of those vesicles are crusted over. So it's a while for that. Eye infections, again, they're, not washing their hands, touching everything in their eyes, absolutely common. We know what we need to. Warm water, wash from the inside out, one towel this side, one towel that side. You don't want to cross-contaminate them, and then put the medicine in. Remember with medicine, eye medicine, if it's an ointment, please let the child know they're going to have blurry vision until it dissolves. That would be scary for a child. Stomatitis, that's when you get those sores around the lips. They hurt. Again, pain relief and teaching them how not to touch it and to spread it and washing hands. Pinworms, roundworms, very real. These are children who like to go outside, sit in dirt, and they get worm eggs underneath their nails, and then they get into the body system. Now, pinworms are that thing that the child's going to start complaining of itching like crazy at nighttime, because at nighttime they come out the anus, and you'll see them around the anal sphincter, and they'll be, and they're wiggling and it itches. So how do we get these worms to diagnose what it is to get the proper medicine? Well, they say, take a flashlight, you tell the parent, and a piece of Scotch tape, go into the bed at night, open the buttocks, put the piece of Scotch tape down there over the anus, pat it, and pull it up. And you'll see tiny, itsy little bits, smaller than a grain of rice. I mean, really small. And then you can send them off to the doctor to get the medicines they need. Another thing to prevent this is washing the hands after playing with dirt, but keeping their fingernails short. Keeping them short's the best thing, because there's no place for those eggs to go. I wish child neglect wasn't real. It is. I've seen some horrific cases of it. I've seen where they were physically abused. I've seen where they held food from a child And it's very difficult to be a nurse and to have a child come in that you know has gone through physical abuse. So what do you do? Because you just want to take who brought them in there and beat them over the head. And it's the hardest thing to do is not to do that. I'm going to give you an example of one of the child abuses that happened. Okay, if you don't want to listen, put it on mute. I was in triage and I got a call from the front desk in the ER. Could you look at this little baby? Mommy's crying and it's a little 3-month-old baby. And the ER was crazy busy like normal. And I said, no problem. If you want me to see that mother and that baby, no problem. Brought the baby back into triage. And the first thing I do is, of course, say hello to the mother and look at the infant, quick look. Take my hand, put it underneath the neck and the head and the buttocks to put it on the scale to get a weight. When I put my hand underneath the head, my fingers behind the ear, it smushed inwards like a fractured skull. And I went, oh my goodness. And she was there because behind the ear was yellow and purplish and greenish. And she didn't know what was going on. She just knew her baby was crying all the time. Well, I instantly had a suspicion. Now, I could have thought it was the mother, and I could have gone crazy, but it's not professional. So I went and I told, hold on, it's the boss. So the end of that story was my grandson called Dean Brown, and Dean Brown called back. Anyway, so he lost his phone privilege. All right, so this little infant, I see a smush, and I'm suspecting. Went to my ER head physician, let him know, and the charge nurse. I personally took that infant to the X-ray department, and we did a CAT scan of the head, and it showed a fractured, displaced bones in the scalp. Then we took the child over to regular X-ray, and we did an X-ray, what we call a bodygram. The sizes of the X-ray films a whole infant can fit on it. We found fractured humerus, fractured ribs, fractured femur, all different level stages of healing. This is a 3-month-old infant. So, of course, DCF was called, cops were called, and come to find out, this was a twin. So we called in the twin. The twin had the same symptoms. Now, the next morning, because I was working day shift then, I come back in and they pulled in the 2-year-old boy that they had also. And he was walking around on a fractured femur and had, again, those multiple fractures. So what was the end of the outcome of this story? Well, our goal as nurses is to keep the child safe. Now, I could have gone crazy. I could have, yelled and screamed at the mother, but in the end, it was actually the father who had done these things. Apparently, the outcome was mom had to work 3-4 different jobs because daddy got fired from his job. So he had to take care of the children and he couldn't deal with it. And mommy was working, so she didn't know. Well, daddy is not around anymore and the children are safe. And that's what working with children and neglect and violence that can happen. I mean, one of the things that you definitely will see, there is a difference between the story and what the evidence of the injuries are. They don't match. It doesn't make sense. And that's when you start thinking. There's also something called mush housing. Mush housing is when mommy likes to keep the kid sick. I've seen things like injecting urine and stool into IVs, wounds, making sure they kept them dirty, so they kept infections. So they just like the whole thing about being in a hospital and being sick. I don't know why it's called mush housing. We have those shaken head injuries. Again, these are all things that are abuse. And our goal in the end always is to protect the child. So we protect the child, we get that child some therapy that they need, and I've seen it where children have been taken away completely from the families or the person that's involved in it, those were removed from the family, but making sure that they have some sort of treatment as they go home. So parents tell them nurse their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse?
Would it be B?
Absolutely. They're being absolutely curious. They're doing the right normal thing. We go, "Oh my God, what are they doing?" It's not bad, it's not dirty, it's normal. Just walk away from it. I know as Kristen used to want to touch himself next to me, I'm like, no, go wash your hands and go in your room. I don't need to be watching you. And that's all that would be done with it. So let's go for a cahoots today. Anybody want to win one today?
I'm sorry, was B the correct answer?
Yes, never. Don't
Okay.
condone it, don't agree with it. Just stop the behavior and go forward. Anybody want to win a cahoots today? Sam? Okay. Brittany? Okay. Alexis, you look like you want to win today. No? Maybe? Okay. Why don't you want? Hold on, let me get to it. There we are. I think the hardest part about, these 3 things, your infants, your toddlers, your preschooler, is don't go crazy over on growth and development. Just, those things you keep hearing me mention, your neck, rolling over, sitting, walking, those things. Wait, 6 months, 1 year, 2.5 years. And then as we get older, it's that toddlers, parallel play, and what does those theorists talk about? I know some of you want to learn every single absolute growth and development milestone, and you'll be surprised they're really not hard hit on the exams or even the essay. Week 2, infant, toddler, and preschooler. 63 of them today. Types of play considered to be sense pleasure play. Sense pleasure. What's a sense? And in this case, it's all about, touching and feeling and liking it. I call it that mashed potatoes, right? It's everything but playing checkers, sand, it feels good. Mashed potatoes smushed everywhere. And then, of course, finger painting, all of those. The nurse noticed the patches, white patches in the mouth of an infant that cannot be removed with a tongue blade. What would you do for that? What do you think it is? So this is probably, the fungus in the mouth. This is that ungo, right? This is thrush. And the way that we treat it is this. We take swabs of, you take a Q-tip and you swab it on the medicine. You're not going to put it on a nipple to suck it because it's not going to get everywhere it needs. You're not going to put it in a bottle. You're going to swab it with a cotton swab wherever it needs to go. And that's the nystatin, what we would use. What type of play is considered cooperative play? And that's checkers. There's a goal. Okay? Cooperative play is two or more children playing together and there's a goal. There is a goal when you play checkers. Sharing a toy, that's associative play. It's two or more children, okay? So that's checkers, a goal in the end. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning what? So what do we know about Kohlberg? It's morality. It's right and wrong and a consequence for either. It doesn't mean they need to do right or need to do wrong. It's just they know that there is right, there is wrong, and there is a consequence, whether it's good or it's bad, okay? Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? Preschool children, we know that we've got to get on their level, get their trust, get sitting below them, and then give them a doll and sit and play. Where are things going to be touched? What's going to happen? Show them equipment if you need it. Now, I'm not telling you to show them an IV and a needle, but we can show them maybe the tourniquet, maybe the arm board or things like that, okay? A multi. What are some findings from a pediatric physical assessment? So physical, you're talking history is the yellow one, okay? Physical is what you can see and touch. And history is what they tell you, okay? Again, remember, I put this question in here because I want you to learn how to read what the question is asking for and explain that, okay? So growth, body systems, breath sounds, abdominal sound, pulses, temperature, those are all physical assessment. History is a history. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? So again, this is one of those questions, which one do you do? It's number one is you first get minimal contact first. You've got to build up a rapport with that child. You're not going to all of a sudden do play and let them touch equipment because they don't trust you. They're not going to listen. They're going to be afraid. Get below them first, so you're not towering above them. Use that minimal physical contact. Give them stickers. Talk about their shirt, their sneakers, their hair, or whatever. Build rapport, then let them touch and play. What would you suspect if you note that an infant's chin is quivering? The fists are clenched and they're inconsolable. You know, when you can't console a baby, something's going on. And when you see that chin going and you see their fists are clenched, they're quivering, that is absolutely pain. And then you put the inconsolable there, absolutely that. The rest of it, they would be consoled a lot easier. A multi. Erickson describes infant as trust versus mistrust. What does trust mean? So a trust is secure. They know what's coming and they're happier. They don't have to cry because their needs are met. A 3-year-old child's having an outpatient procedure. How would you help the child to be less fearful? You know, in this question, it looks like we've already gotten on their level. We've already gotten an open rapport with them. And now what are you going to do? And that's for a 3-year-old. Give them $1, give them a piece of paper with a picture, whatever it is, and let them know what you're going to do. A multi. You need to do an assessment on an infant, and you walk into the room and the infant is asleep in the mother's arm. What are you going to do? So when you have an infant quiet in an arm, even a toddler, this is the best time to listen to breath sounds and to heart sounds. And you would absolutely do it then. Because when they wake up, they're moving and squirming and cooing and grunting, and it's hard to listen. So that is your absolute best time. Leave it in mommy's arms and just listen. When do you switch formula to whole milk? And know that we keep it whole milk up to age 2 because they need the fat. The fat is good for a good, healthy central nervous system. And that's at 12 months. 6 months, we introduce food. 12 months, we change their formula and breastfeeding to whole milk. Multi. When teaching about car seats for a newborn infant, you know, most pediatric hospitals and facilities have these car seat days, weekend things, and actually they give away a lot of car seats for people who can't afford them. A gently used one that's less than a year old, absolutely. Rear facing in the back seat, absolutely. New car seats are good, but you don't want anything old. 10 years old, it's expired, and you should not use it. So you should always check the dates on any car seats that you might get at a garage sale or whatever. A multi. When and how do you introduce solid foods to an infant? So you introduce foods at 6 months, one at a time, 4 to 7 days in between. Never ever add things together. So it's either fruit or vegetables, never together. Before assessing a 4-year-old child, what techniques would you use to approach this child? So tell them the shirt's cute, right? Their hair's cute, the freckles good, the blue eyes, whatever. Batman shirt's good. You're breaking down the barriers. Now you're not this person who just gives shots all the time. Now you're somebody, oh, maybe I can work with you. What technique can be used to examine a toddler? So remember, toddlers are ages 1 to 3. You're never going to do head to toe. On any pediatric child, it's not going to happen. That's only for adults, okay? So when you start making play as part of your examination, toddlers like that. So where is your heart? Oh, let's listen to it. Let them listen with you. Where is your tummy? Oh, let me touch that. You want to touch mine? Use play, and that works, okay? And if they're in mommy's lap, leave them in mommy's lap. When assessing a healthy child's lymph nodes, what would you expect? So if a child is healthy, those lymph nodes, what should you expect? So when you have a child whose lymph nodes are swollen, that kid is sick. If they're healthy, you shouldn't feel them at all. They shouldn't be there. Only when they're sick do they get big. It's showing there's some sort of something going on inside. Which Erickson stage of development levels would be used for a toddler? Well, looking at all those words, which one means toddler? And that's autonomy versus shame and doubt. Remember, autonomy, automatically me, mine, toddler. And the shame and doubt is what? That's when everybody's telling, be careful, don't do that. Let me help you. Let me, and you don't let the child go and explore by themselves. If you don't let them, they're not going to learn. So it needs that we sometimes sit back and let them do things. What pain scale would you use on a 3-year-old child? You will see pain scales, FLAC, FACES, numeric on HESI. You're going to see it on your NCLEX, something you really need to be familiar with. At 3 years old, it turns to FACES. From 0 up to age 3, it's FLAC and nonverbal. We can look at the faces, legs, activity, crying, consolability, which is FLAC, and we could determine a number for nonverbal or younger kids. Faces, age 3 starts, and at 8, numeric. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? Toddlers can do stuff. You need to let them try new things. And that shame is when you don't allow them to try. They can't play all by themselves because they have no filter. They don't know when they could be hurt. So no, they still need supervision. A 2-year-old boy is playing with mud and dirt. What type of play is this? And that's that sense pleasure. Right. Very good. A parent of an 18-month-old boy says that he says no to everything and he has rapid mood swings. A toddler. Is that right? Is that wrong? Should it be? Not? And that's absolutely normal, right? That autonomy, all about me, mine, no, no, no. What is descriptive of the preschooler's understanding of time? And it's all about they know time according to events. With my grandson, I used to say, when you're here, you're going to be here for 2 morning times. So he knew when the sun came up twice, that's how long he was here. After lunch, mommy's getting you. When you wake up, after dinner, after your nap, that's what they understand. They don't understand the clock. A 4-month-old infant is shaking their head. What feature of pain is this infant showing? They're crying and they're shaking their head. What do you think that is? Remember, infants can't tell you what's going on and where they hurt, can they? So they've got to give you a clue. And this is telling you where the location is, probably ear, right? Shaking their head. Sometimes they bang it. Sometimes their hands go in their throat. They're telling you their throat hurts. This is all about the location. A 1-month-old infant's back of their head is flat. What would you tell the mother? She's concerned. The head's flat. What am I going to do? My kiddo, he's going to have a flat head? You know what it is? Their absolute real concern with it. So again, this is the tummy time. Put them on their tummy while they're awake. And that's all they need, that little 10 minutes, 20 minutes. And their heads do shape out well because their heads are soft at birth. They get harder as they get older. A newborn's mother has type O positive blood and the infant has type B blood. The infant is at high risk for what? And this is when they need the light. This is hyperbilirubinemia. You know, their bloods, they fight against each other and they explode and it puts bilirubin into the blood, you know, goes into the liver, and now the baby turns jaundiced. And it can be dangerous. Usually just sunlight or even those fluorescent lights that we put on them will take it away. How do we encourage that bilirubin to come out quicker? And that's by having them stool, by having frequent bowel movements. A breastfed mother has less incidence of hyperbilirubinemia than a formula fed because breastfed, you tend to stool more and it gets rid of that bilirubin. And that's what you want. Which intervention may decrease the incidence of physiologic jaundice in a healthy term infant? You know, this is where we want them to start to poop, all right? this does decrease it because they're feeding. So they don't even get a chance to get there. When you put them in the window, you already are showing jaundice, all right? If you feed them, what happens? They are going to stool, and that's what you want. Get rid of the bilirubin. Which intervention lowers the risk of sudden death syndrome in a child? What intervention lowers the risk of SIDS? I like the one that says keeping the window open if one is smoking near the infant. I'm sorry, that's a terrible, terrible one. It's actually back to sleep on their backs. Very good. Infants crawl before they walk. This pattern of growth and development is called what? They lift their head, they roll over, they creep, they sit, they crawl, they walk. This is all that gross motor. And it's called sequential trends. In sequence, this is what they do. And that's how you should remember that definition. It's a sequence that they follow. How do you communicate with parents that do not speak a language that you know? I worked in an emergency room and we got languages all over, many different that I don't speak or don't know anybody, and it is a real thing. You need to do, your assessment and never use an older child or family member because as they translate it, they're going to put their own feeling on the translation. So it's that blue phone interpreter thing. Very good. What age would most children could understand under, on top of, beside, in, over, under, back of, around, all of those things? Go get your shoes. They're underneath the couch. Go get your juice. It's on top of the table. And it's actually 4 years. One of the things I'm going to have to remind you, forget you have children or no children, because this is what the book says, okay? And I know all children are different. I mean, Christian was doing this by 3 years, but that's not what the book says. In terms of language and cognitive development, a 4-year-old child would be expected to do what? Cognitive development means how they think. And 4-year-olds should follow simple commands. Absolutely. What pain scale would you use to assess the pain of a toddler? And toddlers are the flat scale. At age 3, which is preschooler, it goes to faces. A multi. What safety instructions would you teach the parents of a 6-month-old child? Remember safety, and remember those things I've talked about that you need to be worried about. So at 6 months, they're completely rolling over. So that do not lay changing table, absolutely. 6-month-old children can start to creep and crawl. Yes, cover those electrical outlets. And then, of course, rear facing car seat. And food is always introduced one at a time. A multi. What are cognitive characteristics of a child 2 to 7 in the pre-operational stage? This is Piaget. What does he think? Now, 2 to 7-year-old. What did I tell you these kids like to do? Like taking the broom, right? And riding around, put your arms out, and now you're an airplane. It's all those things. It is, they use objects, they're imaginative, and they don't understand other people yet. They don't get what somebody's trying to tell them. Again, they're trying to figure it out themselves. A nurse receives a phone call about her 6-week-old baby. He's crying a lot every day. What can she do? So a mother's, calling, very upset. 6 weeks old and the baby's crying, 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 crying. What would you tell her to do? Remember, 6 weeks old children, they're still extremely young, they're immunosuppressed. These children, you don't know if it's colic or it's something serious. That child must come into the office. There is no defense. So if you tell them, oh, to burp the child or get some gas drops, you don't know exactly what's going on there. So get them to the doctor. What should an infant be able to do at 9 months? Three months, they lift their head. 5 months, abdomen to back. 6 months, back to abdomen. Then they get up on their knees. So they can voluntarily hold a rattle. They can pull themselves up on their feet and they can roll completely over. And they could sit with no support, unsupported at 8 months. Okay. Again, it's reading the question there. The first expected fine motor developmental milestones for an infant begins with what? Fine motors, fingers. What's the first thing they do? So again, it's that reflex palmar grasp. Then it's voluntary. Then it's crude pincer, neat pincer, objects in at 11 months, block of 2 by 12 months. A toddler parent asked the nurse for suggestions on dealing with a temper tantrum. So if a kid's having a temper tantrum, as we say, ignore it. And I know it's hard. When you feed into that, that's what he wants. He wants your attention. That's why he's having a temper tantrum. So ignore it as long as it's not going to hurt him or anybody else. A 2-year-old has difficulty in activities, has sensory sensitivity, and only speaks one-word responses. What do you think we need to assess that child with? What do you think could be going on here? So this could be an autistic child. Again, they're only speaks one word. They're low in amount of words. At 2, they should be speaking more than that. And that sensory thing is a lot has to do with the autistic children. And then we could get a checklist and figure out if that's where we need to go. They are not diagnosed to the age of 2. Parents are concerned her 8-month-old child is not developing like her older child. What is normal for an 8-month-old child? An 8-month-old child should sit alone unsupported. Absolutely. They are pulling into a sitting position that is a little bit earlier. saying that they're supported or not. First steps is 12 months, blocks and containers at 11 months. A mother of a child is suspected of having mush housing syndrome. What should be in the care plan? Well, if you suspect the mother is making the child sick, what do you think you need to do to protect the child? And the mother is supervised when they're with that child to make sure she's not doing something and to monitor what's brought in. She could bring in foods and stuff that could hurt her. You do not need someone there with the kid all the time, only with the mother there. And the mother still needs to come, but she needs supervised. What fine motor skill is expected of a 4-year-old child? So a 4-year-old fine motor, it's about fingers, right? Button a shirt. Tying his shoelaces is later on. Okay, guys, it's 10 after 5. There's 20 more questions. Do you want me to continue with the Kahoots, or I can just send you the Kahoots and you can finish them all at home? What would you like to do?
If you get some of the codes, I'd rather finish it at home.
You want to finish it by yourself?
Yeah.
Okay. Is everybody okay with that?
Yeah.
Let me hear somebody else.
Yes.
Okie dokie. No, I
Yes.
understand. I don't want you guys going over late. I appreciate your time, and that's okay with me. That's why I brought it up. All right, so remember, Saturday, 2 o'clock, I'm giving the first exam review so that you'll have that before I head to Jamaica. All right, so you will have that. I will be having somebody posting the recordings for you so that you'll have all of them as the week goes on. So you'll never be without, okay? Anything that you all need, you just let me know. I'm here all this week. I don't leave till Sunday morning. So if you need anything, please holler before so I can help you. Thank you guys. Have a good day.
I have a question.
Sure.